Good day, I am Hafsa Ali and I will serve as your teacher for today's video where we are going to talk about angiotensin converting enzyme inhibitor or what we call ACE inhibitor. Now, before we proceed, let me ask you one question. Do you know what angiotensin converting enzyme is? Angiotensin converting enzyme, or what we call ACE, is a central component of the renin-angiotensin system that converts the hormone angiotensin 1 to the active vasoconstrictor angiotensin 2. And these enzymes control our blood pressure by regulating the volumes of fluid in our body. Now, you might be wondering why we have these ACE inhibitors and what do they do? So first, let us define what is ACE inhibitors. So ACE inhibitors are a type of medication commonly used to treat heart failure and high blood pressure and are often prescribed to people following a heart attack. Now, how do they work to treat such conditions? Here's how. ACE inhibitors work by inhibiting the mechanism that the body normally uses to maintain blood pressure. Angiotensin 1 is an enzyme in your bloodstream. Angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, which is an enzyme that narrows your blood vessels and releases hormones that can raise your blood pressure. ACE inhibitors stop angiotensin converting enzyme from doing this conversion, reducing the levels of angiotensin 2 in your body. Lowering your levels of angiotensin 2 relaxes your blood vessels and reduces your blood pressure to a normal level. Lowering your levels of angiotensin 2 also means more salt passes through your kidneys and takes water with it into your urine, reducing the amount of fluid in your body means there is a smaller volume of blood for the heart to pump. By relaxing your blood vessels and reducing the amount of fluid in your blood vessels, ACE inhibitors help to control your blood pressure. This reduces the strain of your heart and arteries. Now, as for its administration, ACE inhibitors are most commonly administered as oral agents, but intravenous forms are available too. These medications most commonly end with the suffix "pril". Examples of these drugs include lisinopril, ramipril, enalapril, and captopril. All ACE inhibitors are prescribed orally except for enalapril, which can be given intravenously. Lisinopril and captopril are the only ACE inhibitors that do not have to be activated in the body to be effective. All the other ACE inhibitors are prodrugs and require activation. Most reach peak serum levels within 1 hour after ingestion. Since most of the activation occurs in the liver, a non-prodrug form is preferable in patients with underlying liver issues. Now, drugs can have unintended pharmacologic effects that can occur after administration of medicine, and this is commonly known as adverse effects. For the adverse effects of ACE inhibitors, most common adverse effects are dry cough, dizziness, angioedema, hypotension, and hyperkalemia. ACE inhibitors has absolute contraindication and relative contraindication. Under this absolute contraindication is the hypersensitivity reactions, in which ACE inhibitors are contraindicated in patients with a history of hypersensitivity to any ACE inhibitor or component of the formulation. Second is pregnancy, because the use of drugs that inhibit the renin-angiotensin system correlates with teratogenic effects such as oligohydramnios, decreased fetal renal function, anuria, renal failure, skull hypoplasia, and death. Now, for the relative contraindications, ACE inhibitors must be used with great caution in patients with abnormal renal function, patient with aortic valve stenosis, and patient with hypovolemia. When these drugs are used at therapeutic doses, the risk of toxicity is rare. Precaution is required when the patient is given an ACE inhibitor and already receives a potassium-sparing diuretics, NSAIDs, cyclosporine, and anticoagulants. as combining ACE inhibitors with other antihypertensive drugs can increase side effects like hyperkalemia, hypotension, and renal failure. Also, before you stop or change any medication, even if you are worried about its side effects, talk to your doctor first, as changing or missing a dose could harm your health. So that's all what you need about ACE inhibitors, and I hope you learned something about it. Again, this is me, Hafsa Ali, a pharmacy student, and reminding you to always take good care of your health. Thank you and God bless.